It's nice to have you back. The Lagos State government says it is mandatory for all residents to enroll under a health insurance package. The State Health Management Agency, while imploring residents to seek cover, assures it would work with the private sector to ensure equity and transparency in the implementation of the insurance scheme. Wilson Omoniyi reports.
The current youth population in Nigeria is a positive and negative indicator. While the youth are capable of advancing the country's economy, it is also indicative that many Nigerians do not live well into their retirement age. The Lagos State government is looking to stem this tide by mandating all organizations and unions to procure health insurance for all employees with the hope of promoting healthy living within its populace.
UHC means that all individuals and communities will receive the full spectrum of health services they need without suffering financial hardship. And the quality of those services will be such that would address the most significant causes of diseases and deaths, thereby improving the health of those that receive them.
But while such a policy exists at the federal level, there are areas to improve on, especially when reaching out to local communities.
It's like a referee who oversees and makes sure that there's equity. Equity for the hospitals that are providing service, equity most importantly for the citizens of Lagos State, equity for other participants like the Health and Managed Care Association of Nigeria, and indeed all stakeholders in this new scheme that is being rolled out.
You will know that the CD and the CDCs at the various levels, stakeholders, markets, unions, transport unions, all these relevant stakeholders, we are going to engage them in terms of communicating the issues and the regulations.
For the State Health Management Agency, while insurance is mandatory, the effectiveness and transparency of the various plans and schemes would help to convince residents to get a health cover.
If there are issues with your plan, whether it's your HMO, whether it is the health facility, you get back to the agency and the agency addresses these issues. So it's an open door policy. We encourage feedback and we also go out to do the monitoring. We will be outsourcing to the private sector as well because it is not something that we can do alone. To ensure that we have efficiency and we can cover the whole of Lagos, there will be frequent visits to the hospitals to audit the processes of healthcare to be sure that people are getting the standard that they are paying for and so on and so forth.
Health insurance is an essential part of social security in developed nations. It is key to the elderly getting the care they need while improving infrastructure and service delivery in the entire health sector. Wilson Omoniyi, Silverbird News 24, Lagos.